Hi there everyone, it's Sarah here from BJC Health. Looking forward to taking you through another one of our live educational events. So this is part one of a topic we called a real pain in the butt. So if you've had a gluteal tendinopathy or know someone that has, you will know that this can be a really tricky thing to manage, and so we were really looking forward to having an event that discussed this topic in a lot of detail. And thankfully we've got someone at BJC Health who loves talking about tendons. His name is Tim. He's a physiotherapist based in Sydney, Australia. So he's hosting the discussion. You've got part one to watch, and if you'd like to see the full presentation, then please consider signing up for BJC Connect, where you'll be able to watch the rest of the talk as well as a number of other educational events and recordings that we have. But enjoy the presentation. I hope you get something out of it.
Good evening, everyone. It's lovely for all of you to join us here again on a Wednesday night. So welcome to BJC Connect and welcome to our fortnightly events. I have the pleasure of introducing one of our very experienced physiotherapists, Mr. Tim Lee. And actually, we call Tim Tendon Tim. For some reason over the years, he's just found particular expertise when it comes to tendons. And if you've heard, sometime last year, he already did his first session on tendons and tendon pain. So today he's going to go that bit further to talk about tendon pain or lateral hip pain, pain on the outer portion of our hips, which unfortunately many of the patients we see have. And so his talk is titled "A Real Pain in the Butt." So on that note, I'm going to throw over to Tim. Thanks, Tim.
Great. Thanks, Errol. We're talking today about gluteal tendinopathy and bursitis. And again, thanks for joining us today. We do know that this area can be a real pain in the butt. I put there all the hip because it's actually quite lateral or on the sides. But we know, like a lot of the tendons that we see, that it's quite a difficult and sort of tricky area to manage. So I'm hoping with what we go through that it's going to help to kind of encourage you guys to kind of get moving and kind of learn a little bit more. Again, if you have any questions or anything else that you'd like to know, please put it in the chat. Errol will have a look through some of those and we'll go through as you go along. And at the end, there'll definitely be some time for questions. We'll also encourage you to kind of have a watch of that first session. It was about 6 months ago. So that was during kind of the earlier lockdown, and it's got a lot of general information that's going to be really helpful, especially for the session today and the things that you're going to learn. Now, you may remember from the first session that gluteal or sort of buttocks tendon pain was one of the most common ones that people responded with, and definitely is what we see in the clinic with about 20% of the people that we surveyed last time. And we know that, again, it's common. It's something that we do see quite a bit. Today, we're going to go through a little bit of a refresher about some of the concepts for tendons. We'll go through the anatomy and the function, or what this area does. And then we'll look at some ways that we can try and reduce the sort of pain through lifestyle adjustments or offloading. We'll go then through some other pain management or treatment options. And then we'll go through one of the big ones, which is exercise or tendon reloading, which is what people need if they really want to get back to full capacity. So just touching on some of the basics from last tendon session, it's all about loads. So you've really got to know and understand what it is that's going to load this tendon. And then you can work on some ways to try and help reduce the load. It's also important to remember that tendons adapt quite slowly. So they're quite sort of thick and fibrous, and they don't have a very good blood supply. So compared to something like, a nice juicy muscle, they're not necessarily going to recover as quickly. The first step in recovering tendons really is offloading it. So again, once you know your loads, you can start to do that. And then the big one, again, exercise to regain the capacity of the area. Now, what are some of the signs that someone might be dealing with a sort of gluteal tendinopathy or bursitis? Now, probably the biggest one is the area of pain or the potential referral. And this picture on the side here kind of has a good example. Normally, they'll demonstrate sort of pain right on that sort of point of the hip. So, you've kind of got the widest part of your hips. And if you've ever heard of some sports people, even they get sort of a hip pointer injury, this is sort of one of the areas that they're normally talking about. There's often a load relationship with the pain. So this might mean that if you were to increase your walking or do a lot of extra stairs or standing, you might notice that your pain increases. But there may actually be a delay as well. So people sometimes warm up while they're doing the walking, and then the pain actually increases later or even the next morning. People will often have pain when lying on their side. So like this guy, they might not be having the best time when they're trying to sleep. And first thing in the morning, the area can be a little bit stiff or a little bit sore, or even after someone's been sitting for a while, like if they've taken a long drive and they've gotten out of the car. And oftentimes, that sort of the clinical diagnosis, or what we hear from patients and what we can see in the clinic is, quite a good sign of what's happening. But in certain cases, it is still maybe advantageous to get sort of a scan or something else to look at the severity, because this might help us to kind of work out whether there's other management options that are going to be needed. Okay, so let's talk a little bit more about the area. So just a reminder that tendon attaches muscle to bone, and it's kind of this white sort of parts at the end of the muscle. The most commonly affected gluteal muscles are the lateral ones. So in this picture here, we've got the gluteus medius, and also on the bottom here. So that's a picture from the side. And then underneath that muscle, you have the gluteus minimus, which kind of sits here, and also underneath it on the side, kind of like fanning out towards the crest of your hip. The main action of these muscles is they help to abduct the hip or take the sort of leg away from the body. But they mainly actually work when you're standing on one leg, and they help to stop you dropping out to the side. Just a note that it is possible to get tendinopathy of the other tendons around the hip, but these tendons are the most common ones that we see in our clinic. And the other structure that's often affected around there is called the bursa, and it's very closely related to the sort of lateral gluteal muscles, and it's a little small fluid sac. So if I kind of show you on this picture here, kind of sits right on the top of that bony prominence on the side of our hip, and it acts like a lubrication for the soft tissue to run over the sort of firm bone. And we have these all around the body. This is part of the reason why maybe compression on the side of the hip usually hurts. So if we push someone right there, or if they're laying on their side, they may notice that pain. And it's actually sort of cushioning these muscles on the top, known as the sort of ITB, you might have heard that, or the tensor fascia lata, which also comes into the gluteus maximus. And all of these sort of shared tendons go over the top of the bone. So that's what it's kind of helping to stop rub on the top. And it kind of actually lines up quite similarly with what people experience from a pain pattern, with that sort of side of the hip, sometimes down the leg, can even be a little bit to the pocket or a little bit to the sort of back of the thigh or buttock as well. Now, again, the main function of this area is keeping us really strong and stable, especially when you're on one leg. So this will include things such as walking, especially when you're doing stairs or running, which requires even more work on it. If you're climbing something, if you're doing any sports, especially when you've got to go side to side, if you're squatting, or if you've got to get out of a chair, these muscles really help to keep your legs out and in a good sort of functional position. Now, if you guys got a bit of space and you would like to, we're going to do a little test now. Just going to get everyone to stand up. If you've got the space and you're not too comfortable on the couch. Stand. And one of the simple tests that we do in the clinic is actually just get people to try and stand on one leg. So I can see a few of you, but not sure how everyone's going. But we are kind of having a look to see how stable people are when they do that. And there is a sign that we call the Trendelenburg sign, which refers to when someone's standing on one leg and they kind of drop quite a bit to the side, like they just can't keep that hip in a really good aligned position. We also do another test to kind of check these muscles, where we actually allow people to have a chair or something in front, so it's not so much about the balance, but we see if they can do that position for 30 seconds or more with or without pain on the side of the hip. And that can be quite a good indication if someone's not able to do 30 seconds without pain, that they may have an issue with the gluteal tendons or the bursa on the side. And if people can pass that test pretty well, you can keep going if you want, or you can have a sit down. But if people can do that test pretty well, we're going to try and test them a little bit more. So we might be doing, say, a squat or even a single leg squat, sort of in that position, but kind of squatting down. You might be doing some jumping, running, things that are going to be sort of significant for what they want to do or when they're getting their pain. So we included this as a kind of refresher from last session, but these are a few of the things that may be increasing load or putting more work on the tendon. So it could be duration. So if you're going for a longer walk, speed, surfaces, compression, heels. But particularly for this tendon, there's a few different ones that are going to be key. And again, usually it's people who are increasing load too quickly. So if they're walking longer or faster or striding out a bit more, that's going to put a bit more work through those tendons, because each step they're going to be maybe moving a little bit more. Obviously, if they're running or adding, quite a bit more load. The terrain can make a big difference. So if people are doing a lot of hills or stairs, or even uneven surfaces where those muscles have to work harder to keep people in a good position. So sand as well, if you're going on like a hike or something where there's a lot of sand. And mechanics can make a difference. So as well as the structure, so we know that it's more common for females to have gluteal tendinopathy just because their hips are a little bit wider compared to the angle of their legs, but also how people move. So you can imagine even like a model kind of walking down the runway, they've got quite a lot of side to side movement, and that actually works those tendons a little bit more. So people, when you see them and you see them moving that way, oh, maybe they're either the muscles aren't strong and stabilizing them, or they might be putting a little bit more work than they need to through those muscles on the side. The other one is not enough strength or endurance in those muscles. And this could be, like something that you can strengthen up through some exercise. It could also be increased weight or mass. So put on there, even if you're pregnant, you've got a baby, or you're carrying a big hiking pack, something like that, that can also, put a bit more work on it. And compression. So if you're sleeping on a new very firm bed, or you've gone camping on something, you've stepped on the firm ground, those sort of things can irritate it as well. Okay, so we know some of the things that can potentially irritate or bother this tendon. And this next slide is a table that we use for the people we see in clinic. It is up on Connect, so you guys can grab it down later, or you can email me afterwards if you would like it. My email will be at the end. But these are the sort of main things we need to address for most people. And we'll go through their history and kind of work out the key ones to focus on. But don't worry, because we're going to go through each one more specifically. And the first is sort of walking. So again, for most people, this is their sort of key factor. And the things you can do to help with that is to reduce the amount, make sure you're on sort of more smoother, sort of flatter surfaces, reducing down hills or stairs where you're able to, or even using the support of the handrail to try and offload it. Again, you can reduce your speed, which is going to take less work on it. And you can also use something to support you if you're finding it very difficult and painful, such as a stick or of the sort.
So there you have it. That was part one of a pain in the butt. I guess our talk all about gluteal tendinopathy. So if you'd like to finish watching the presentation, then please consider signing up for BJC Connect. That's where you can watch part two, as well as access a number of other live events that we have going on all the time, as well as access a number of other recordings that you might find useful. But thanks for watching. Enjoy the week ahead and look forward to seeing you soon.